Well, I want to thank you, Greg, and the members of SEIU, my co-laborer in this struggle, Jackie Algie, for always convening and including the Rainbow Push Coalition. And on behalf of Reverend Jackson and the Board of Directors of Rainbow Push, we're really concerned about this issue because we now have two groups at risk. We have the patients at the Loretto Hospital, and we have the staff. And I think that we're willing to help you share with the Loretto Hospital administration, management, and with the broader community that our safety net hospitals are essential. They're essential to the community. And when you say safety net, that means that they are essential to catch those who will not make it to a rush and will not be admitted if they get there because they have inadequate insurance. They don't have the appropriate benefits. And so when Loretto is not whole, then our community is not whole. And so that is a concern for us, which Greg and Jackie has to be on the agenda for these people running for office, whether it's at the Senate level, U.S. Senate, the United States House of Representatives. We have to push them to preserve and provide for funding for these safety net hospitals. If Loretto and Roseland and all of these hospitals that are in the community where the people are most underserved, under-resourced, and at high risk physically, the communities are full of violence, they are food deserts and all of that. Those hospitals have to be fully resourced. That's number one. Number two, the first responders are everyone that works in the hospital, from the janitor who sweeps up the blood on the floor, mops the blood on the floor when people are brought into emergency room, who cleans all of the beds and changes the linen, to the phlebotomist, the ER. Every one of those workers are essential workers. Therefore, they are due and owed hazard pay. They are due personal protection equipment. Now, they can't effectively serve people when they are at risk themselves, and then they go back and place their family members and the communities where they live at greater risk. And so this is not an optional situation. This is a necessary move that we protect the workers so that they might protect the patients and that they might remain healthy enough to serve the patients and meet the needs of those who come to Loretto already vulnerable. They cannot be placed at greater risk because they're understaffed at the hospital or under-resourced. And so we've come to be supportive of convening others to bring this to some national attention, because this hospital is like many others around the country where our most vulnerable people are getting the least. And you're asking the people who get the least to do the most with the least. And it's not fair, it's not right. And so that requires us to look at budgets at the county, state, and federal level to reallocate. In the meantime, Reverend Jackson has negotiated many disputes between labor and management across the years. And I think that there has to be maybe a three-way conversation with Loretto, the community, and SEIU, so that they understand it's not just SEIU, it's all of us demanding that a Loretto Hospital be made whole and that the workers be protected and provided for. We met with a group on the south side. They were trying to create a merger of the safety net hospitals. And I'm sure that they're trying to look at it on the west side. The problem is the safety net hospitals are a place where people can walk to them. They have easy accessibility. And somehow there is a national move to eliminate safety nets so we have no net. and we must fight against that. And so we are praying, not just praying, but we're ready to support the workers in every way we can. We will make sure that you eat while you are, if you have to go on strike, but we'd like to prevent the strike, because there are resources. Where there's a will, there's a way. And so we have to have them have the will to move in a positive way for the workers. These are our essential workers, and we support them.